services and resources and programs. Before we jump into some of the questions that we've received, and we're monitoring this on Facebook, so please put your questions in the comments section, and we'll get to those here in just a few minutes. But Seth and Mayor, before we jump into some of those questions that we've received, first off, we certainly want to remind our residents, do those things that the CDC is encouraging and recommending that you do in terms of hygiene, washing your hands, coughing into your sleeve, avoiding contact, large groups, things like that, to keep yourself safe and keep your family members and your neighbors safe at this time as we're all kind of navigating this unique and new situation. Again, and thank you to our residents. We've been in contact with some local businesses, and they've been appreciative despite the number of people who've been shopping lately. They're appreciative of the respect and the patience that our residents have had as they go about their business and shop here in Spanish Fork. So thank you to those of you who've been shopping here lately. Kind of a quick update. We've noticed this online, and again, we post all of our updates on our website at SpanishFork.org/COVID-19. That's the best place for you as a resident to get some of those updates as to how services in Spanish Fork City have been or are being impacted. You can get to this directly from our webpage, our homepage. But as a reminder, the Senior Center is closed until further notice, as is the library, and park and recreation programs have been postponed until at least March 30th, at which point we'll reconsider and reevaluate those programs. So before we jump into the questions, I'd like to ask Seth, it's a unique time here in Spanish Fork, and I don't know that we've really ever faced something like this. What's the city doing in some of these areas like the library and Parks and Rec to address some of these unique circumstances and challenges that we face?
Oh, thank you. It's definitely unique. I think one of the best ways that I can describe the way that we're operating and the city's functioning today is that we're open, we're operational, and we're capable of serving you, but it's definitely not business as usual. What I've been impressed with is how well each of the departments have been adjusting and adapting to the changes that are coming at all of us pretty much every day. And so every day we're kind of adjusting the mix of how things are operating. But at this moment, we are capable of helping you. But I will say this, Scott, we're still seeing more people coming into city office buildings than we think we need to. But to that end, let me maybe highlight some of the things that we're doing, and I'll come back maybe on this point of more people are coming here than I think we need to see at this time. The library is closed, but they are doing kind of a virtual checkout with curbside service. Through their library checkout systems, you can reserve books, and that order can be filled, and through communication, you call ahead, they can have that ready for you that they'll bring outside of the door and give to you in a bag. You can also bring your books in, and they're taking all of those returned items, and they're actually putting them in kind of a book quarantine, and they're holding books for about 3 days before they actually check them in, so that they have a chance to, if anything's on them, that hopefully dies away. We've asked the public to not come into this building, the Thurber School, but we're still able to do all building permits, building inspections. We've made some adjustments, but we're still able to do all of those. SFCN is still doing check. They're still connecting internet at your home with appointments that they've already had, but they are changing a little bit how they're doing that. They're asking questions about each home, specifically about health in the home and how things are within each home they're going to. And if they're encountering somebody that is sick, we're not doing that service. Let's see, what else? Each department has some significant changes in the way they're operating. Of course, Parks and Recreation has the most maybe community-wide changes to all of their different programming. And we encourage the residents to keep looking at our Facebook pages, our calendars and things to find out what's changed. If you're wondering if something has changed, the answer is probably yes. And if you're wondering if you can get service, the answer is still probably yes, but in a different way. And we're trying to find different ways, and we're being creative. So before you get in your car and drive to a city facility to walk in to talk to us, pick up the phone and call somebody first and see if we can help you remotely. And you'll notice that in this setting right now, we're trying to stay our 6 feet apart, and we recognize the importance for social distancing. I've been on more virtual meetings the last 36 hours than I ever have been in my life, and frankly, they've been quite effective. And so if you have a need to interact with City Hall, pick up the phone first. Call us. Lots of numbers on our website. Yeah, the phone number is pretty simple, 801-804-4500. That number can get you to just about anything. So before you come to City Hall, call us. Our bet is we can probably help you remotely.
A common question that we've heard the last week or so that this has really ramped up. We understand that our senior population are the most vulnerable to this strain of coronavirus, and special precautions should be taken to help our senior population. We've closed the senior center to help limit those interactions and reduce the potential for transmission at the senior center. Mayor, can you talk maybe a little bit about your experience that you had locally shopping, some new changes that are going in at some local stores?
Yes, I can. Thank you. Some of the grocery stores are opening their stores an hour early for senior citizens. I went today at 7 o'clock to one of the businesses, went into the grocery store. They were letting just people in that were 60 and over, and it was a pleasant experience. It was just like going to the grocery store normally. People were very polite. They were able to get the items they needed. There was plenty of things on the shelf. Didn't seem like they were in dire need of empty shelves like you see on Facebook. But I was able to go through and watch everybody. I picked up some items that have been hard to get, and it was just nice to see all the seniors being able to get the things they need and not panic, because that's one of the things they were worried about, being able to get out and get the things they need and fight all the crowds. So kudos to those local businesses that are opening their stores just for seniors, to let them get in, get their things they need. And it was a great experience. I appreciated the people there. They weren't hoarding anything. They were just getting the things they need to get them through the next few weeks. And that's what we need to do. Just stay calm and just shop for what you need.
Right.
One thing to add to that, Scott, I think as questions have come in about what are you doing for the seniors, the best advice that, of course, is out there today is that the seniors shouldn't be doing much. Stay isolated. Stay at home. Do activities at your home. My mother's 75 years old, and we've had daily communications with her. So keeping engaged with her, but she's not leaving, and I don't want her to leave. I love this idea of shopping, so the seniors can get out and shop in a little less stressful environment, as well as fewer people to interact with, right?
Exactly.
But generally speaking, if you're over the age of 60, we strongly suggest that you stay home, stay close to home. We had a gentleman that came into the building here to deliver something today that was absolutely unnecessary, at least for the circumstances of today. And that's the best advice. And so to community members, neighbors, I would say, if you have neighbors that are seniors, connect with them, next door neighbors, connect with them by phone, ask how they're doing, check up on them. If they need help getting things, offer to provide that. don't necessarily go into their homes as much, or if at all. The best way to provide, I think, services to those seniors is to have it be close to home and limited.
And just on that point, Seth, one of my neighbors across the street from me, an older gentleman who was outside, we yelled across each other across the street, asking him how he was doing. If he needed anything, he said, no, I just went and got my popcorn, so I'm good. And I told him, I said, if there's anything you need, let me know. We can go back and forth and trade for whatever you need, or I can just bring it to you. And he was appreciative of that. And that's what we need to do, is look out for your neighbors, see what they need, and we'll get through all this.
Right, and though the senior center here in Spanish Fork may be closed, I understand that Utah County and MAG, which is Mountain Land Association of Governments, their Meals on Wheels program is still going, and so seniors can get meals delivered to their home. And so we suggest, if that's applicable to you or your loved one or someone that you know, to contact MAG. If you just Google Utah County Meals on Wheels, you'll be able to find that.
Generally speaking, the seniors that are receiving those services already know this. So this is probably information for the inquiring minds, but those that are actually using the service already know this. And I think one important thing to add here is that seniors, as well as all of us, we can get out for walks. It's not necessarily a walk that you're going to go and stop every house and talk to the neighbors like you would normally in the summertime, right? But certainly get out and go for walks. Seeing the sun, being active is good, and being outside, good social distances, but just being outside is a good idea. And that will be helpful, because being cooped up isn't always the best thing, right? So get out, go for a walk, but maintain good social distance if you see neighbors and friends.
Exactly.
So we hear this term a lot, social distancing. Seth or Mayor, maybe what are some other suggestions or ideas that you've heard as you've interacted with Governor Herbert, the state task force, on things that, while we should be limiting our distance, what are some things that maybe our residents can still do to enjoy their life during this period of uncertainty?
Yeah, get out and enjoy the outside is really a good thing. Stay relatively close to home. Some people have talked about going like to Moab, and I'll social distance in Moab. That's not the best thing right now. Stay closer to home, but if you can get out and enjoy the outdoors, go for a walk. Absolutely do that.
No, and also on those lines, my wife and I, over the weekend, we were walking the trails. A lot of people were out there enjoying the park. And so keep doing that. But also, now that the state has asked us to close our restaurants, the inside seating, they're still offering drive-through, and you can still go through and get your meals that way and support those businesses that might be hurting right now. If you're used to, you can do that, and you have minimal contact. And you can go through the drive-through, get the food, and you can still support those local businesses and enjoy the food that you like to eat.
I know that the local Chamber of Commerce has created a new Facebook group, and as well on their website, they have an area for local businesses to post what it is that they're doing, what services are still available, maybe some of those modifications that they're making to their service delivery, so that our residents can still take advantage and use the wonderful businesses that we have here in Spanish Fork City. So we encourage you, Facebook users, to go jump on that Facebook page. If you're not so inclined on Facebook, go to the Chamber of Commerce's website and get some of that information there. But certainly continue to do those things that you enjoy doing. If you go to the park, make sure you wash your hands, you wash your kids' hands, and even the state of Utah has, though they encourage us to still enjoy our life, to take those precautions, maintain that distance, maintain and increase that level of hygiene as you're out and about touching things, perhaps at the park or along the trail. So
I think this Facebook page is a great example of a local community doing what we do really well. Getting out some information, helping you to know how are our businesses functioning, and are there ways that I can take advantage of their offerings still, but maybe in a new way. And so kudos to our Chamber of Commerce for doing this, and all residents should connect with this as Scott has suggested, and if there's a way that you can still use them, that's great.
And I actually just got a message that says MAG, in terms of those senior meals, they're actually doing a senior meal drop-off at the Springville Senior Center. You just need to reserve your meal the day before, and you can do so by calling. And great, the comment just covered up the phone number. I apologize. Call 801-489-8738. Again, 801-489-8738, and you can reserve your meal the day before. Something else, and we'll briefly touch on this, Seth or Mayor, if either of you want to talk a little bit about this, but we kind of have a unique relationship going on right now with SFCN and Nebo School District with kids that are at home. Can you briefly talk about?
Yeah, really briefly. This is, again, for those more directed at them already, but there are some residents of our community that may not have access to the internet already, and with this change in school, their kids are at home and they now have Chromebooks. So SFCN has actually coordinated through the Nebo School District to make the internet available for those families that don't have it. Information is coming to these families through their principals, and they can get that there, but we've been able to help a handful of families, and I'm pretty certain that we'll be able to help a few more, and I think that's great.
Jumping into some of the questions that we have coming through here on Facebook. Let's see. So and this is from Karen Young. Thank you, Karen. With the 2-week delay of the current Parks and Rec programs, why hasn't the city gone along with the CDC recommendation of 8 weeks and expand the delay of those programs?
That's a great question, Karen, and I probably just simply say we haven't not gone along with those recommendations. With all the different activities we're doing, we're simply trying to assess them and make decisions, and so we've certainly postponed everything for 2 weeks. I imagine next week we'll have a better sense of how things are going. We've really taken a look at activities up to and about through spring break for the Nebo School District, which is that first full week in April. So I don't know what if that we won't follow that. For example, well, let me rephrase that. We are going to follow in lockstep with what's happening. We haven't not followed it. We're just taking it a little bit more chunk at a time. But boy, we're hopeful that we don't have to do this, for a long, long time. And it's hard to roll things back once you've canceled things. And so if we can just take them in chunks and everybody just be working together, we'll have a better understanding of how we're going to do things. Don't be surprised if things in April do get canceled or postponed or pushed back further. But we really, really hope we don't have to. So keep in tune and watch. Chances are you'll see some of those things move.
And in response to Jennifer Whiting-Webb, she asked if the baseball, softball season is still going on. Again, if it's during the next 2 weeks, then it's postponed at this point. But again, we'll kind of reevaluate as we go through this process together. Let's see, kind of scroll through and see what other questions that we have popping up here on our Facebook feed. Again, if you have any other questions, please put them there. We'd love to answer them for you while we've got Seth and the mayor here. Let's see.
While you're looking, I'd say, Mayor, last night you made a declaration, an emergency declaration, which is something we haven't done for many, many years, and it was reported in the Herald. One important thing about that declaration that the mayor made last night is that we have a typical course of operation, and declaring an emergency allows us to shift that just a little bit and follow some adjusted policies and frankly policies that are temporary. So it allows us to kind of bypass our typical policies and allows us to do things a little bit differently. Really not something that the public would notice. Not like we can't tell we're in kind of a different state anyways, right? Things are definitely different. But wanted to address that. You made that declaration yesterday, and it allows us to do some things with our employee groups that are different than normal. It allows us to enact some policies again for the employees that are different.
A question that we were asked yesterday, and I think it's still relevant today and will always be relevant as we face situations like this, emergency situations. How do we communicate with the public, and how, as a resident, can I better ensure or expect to be communicated with the Spanish Fork City services and programs?
So the first thing I would say, Scott, is our job is really focused on this Spanish Fork area, and we don't do health. That's a county health thing. The county does health departments. The state does health departments. Cities don't typically do that. And so we really do want to stay in our lane. And so I don't, for all the most and best information about the coronavirus, we're going to tell you go to the CDC's website. We're going to tell you to go to the state's website, and that will give you the best information about the coronavirus itself. We're really going to focus on things here. So, is the garbage going to get picked up? How's the utility services? How do I pay my bill? Questions about recreation programs. That we will really best be able to focus on those things. And so if you want more global and more answers to those kinds of questions, we'll always push you to the state and county health departments or to the CDC. If you want specific Spanish Fork questions, look on our website and find that information there. That's a great place to go. You can follow us on Facebook if you haven't already, and you can call us. We send out tweets, we send out Facebook posts and everything else. And so I think those are good methods. And I'll be honest, Scott's done a fantastic job of
Definitely.
Communicating to the public and keeping information in front of them. We're grateful for what you're doing in that regard.
Thanks.
Mayor, you want to go ahead and use some hand sanitizer there?
Oh,
I've got some on my belt.
He's got some in his drawer.
I got some right here, right in the, water went down the wrong throat.
Wrong pipe.
And might I add, in addition to those resources, social media, our monthly newsletter that will be coming out the first week of April, I'm certain there will be some information included in that regarding COVID-19. Again, our website. We do have a tool that we use in conjunction with Utah County, which is our emergency alert program. And you can sign up for this if you haven't already. Go to SpanishFork.org/alerts. And here you can sign up to receive emergency alerts, right? So we don't use this for everything under the sun, but in case of a real emergency, if something really critical were to happen, this would be a great tool for us to do. I think the common term for this is like a reverse 911, where we can do a phone call, email, text message to residents to notify them of those types of alerts. So that's another tool that we have at our disposal to contact and communicate with our residents. Let's go back to our Facebook Live and see. Let's see, from Tristan Duro, will this have an effect on construction? For example, construction on the All Abilities Park, construction for new businesses and homes?
It's a great question. Hopefully it doesn't. For the time being, inspections are still able to happen. Construction is happening. A lot of construction happens in small groups. And so the All Abilities Park construction is still going. And construction on homes. It's quite important, actually. In fact, Governor Herbert, Lieutenant Governor Cox, in meetings that we were a part of yesterday, stressed how important it was that these functions continue. And so we are, as I mentioned, inspections are still happening, and our people are doing a great job of those. And they are asking, is everybody in the home okay? I mentioned this earlier, but generally on a construction site, there aren't a lot of people there when I go in to do an inspection. And so our inspectors are able to do that. And as long as we can keep going, we will. And so hopefully it doesn't have an impact on those. And if you haven't looked, you don't have to go to the All Abilities Park and see that construction, but you can go on our city's website and check out the construction of the All Abilities Park. The mountain is starting to take shape. It's pretty cool. It's
Channel
really
16.
Neat. Yeah, Channel 16 as well. If you have our Spanish Fork cable, you can also see that. Really cool.
That's really good. And what we're going to do is we're going to make sure our inspectors are safe. We'll probably use that same protocol if they are going into, say, a home, to a remodel or something like that. We'll want to make sure that those questions are asked, if there's anybody sick or anything, and then we'll make sure that they're protected. We want to keep the safety of our employees utmost on all this.
Right. Do we anticipate perhaps that the situation might expedite the construction process on, say, the hospital or even Station 62?
I don't think so.
No, because one of the problems you're going to have is materials are probably going to slow down getting some of those. If they don't have them on site now, it could. I'm not saying it will, but I'm sure a lot of the shipping time is going to be lengthened out because these people can't get it. And so when we took the tour of the hospital here last week. They're still going full bore, and they never said anything that things were being delayed, but that's a possibility.
Yeah, and as far as construction goes, really the only way to speed things up is to put more resources into it. You know, add more people, add more positions, add more resources. So I think you'll just see them continue as normal.
All right. We have a comment here, thanks Susan, indicating that if you'd like to get alerts from the Utah County Health Department, which obviously will have more information in terms of the health aspect of this situation, you can text UC Health to 888-777. And this is more of a health-related question, but I think it's one that we hear a lot, and we have some information on this. If I'm concerned about my health, if I'm starting to cough, if I've got a fever, who do I go to? What do I do? Do I call my health provider? Do I show up at the hospital?
Yeah, let's pull up maybe the website. Where do you want to go? Do you want to go
to it's
coronavirus.utah.gov. And we'll just refer to that. I think this is a great question to ask, and it's one I don't want to just simply say, let me just tell you what, but let's refer to those. I think you want to answer those questions by going to a website like this. Don't rely on your friend, your neighbor. You want to go to these official places, these official sources, and then have contact with your doctors. As I understand, the doctors are asking you to do a lot of that work remotely as well, so you can use telehealth. You can use, you can call your doctor's office as well. Get some direction from them, and then if they want to see you, they will invite you to come in. And so one good safe answer is if you don't know, if you're uncertain of your health situation, should you self-isolate, you can always start with that and then identify, with your doctors better if you should or not. That's kind of a good false positive. Is that the best way to say it? Kind of a false positive. I don't know. Start there, and then you can do some research.
Tyler, if you scroll up to the top, or even right there, the FAQ, they've got on this page, this is run again by the state. They've got a variety of different questions on here, and there's one, if you scroll down, that says, what should I do if I come in contact with someone who came from an area with widespread coronavirus illness? And in there, it talks about contact your healthcare provider immediately if you start to develop symptoms such as fever, cough, or difficulty breathing. So that should be your first resource or go-to if you start thinking you're sick, rather than inundating healthcare facilities.
And I'll tell you that you ask a question to me like that, my answers get to be kind of general and frankly kind of weak. That's not my area of expertise. That's not my lane. You want to talk about is our sewer plant functioning? Is our power system functioning? That's our area of expertise, and the answers to all of those are yes. But you get into the matters of this kind of stuff, and I will defer and make. Let's look at these other websites, because that's a great question to ask those other experts.
Right. Another question that came through that isn't, I think, pertaining to the COVID-19, probably more in response to the earthquake and subsequent aftershocks that we experienced today. In terms of fueling up vehicles, and I understand that there was kind of a rumor going around today about refineries being not up and running. They've shut down and whatnot, and the Department of Emergency Management for the state came out and said that is a rumor, that refineries are up and running, and that there's no need to rush the gas stations to fill up your vehicle, your wife's vehicle, all of your gas cans in the garage. But
Yeah. And maybe this is a COVID Facebook Live, but maybe we can make it a COVID and earthquake live for just a moment. But we shouldn't be doing a whole lot of traveling right now, right? We're not going anywhere. We're not making long trips, personal trips to even Salt Lake County. We really should be restricting our lives and not going very far. So if you've got a half a tank of gas, you've got a lot of gas. Stay away from the gas stations right now. Don't add to the level of panic that occurs, and to the residents that feel anxiety, which this morning we felt a little bit of a tremble in Spanish Fork, and how long has it been since we felt that? Totally understandable, but just do your best to stay home, and a good rule of thumb is to always keep your gas tank at half anyways. Some of us are better at that than others. I'm horrible. My wife is fantastic at that. But if you got a quarter tank of gas right now, you're probably going to keep that quarter tank of gas for a couple of days, because we're just not traveling very much.
Exactly.
I don't see any other questions coming through. Seth and Mayor, do you each want to just maybe take a minute or so and
maybe
final thoughts?
Going back on the lines of the earthquake, there's a lot of people concerned about the buildings and services, our water lines, sewer lines. Everything's fine. Everything's good. The roads are fine. Our employees are so good. The departments went out as soon as that earthquake hit. They went out and started inspecting bridges and roads and the utility lines and things like that to identify any issues, and there was none, as far as I understand. There was none. And so, probably the nice thing about it, especially up there in Magna where that hit, nobody was at school, and a lot of people were at home, and so minimum damage. So if you look at the bright side, everybody was supposed to be home anyway when that hit, and so that was a good thing, if it can be a good thing on an earthquake. So maintain, just stay calm, and we'll get through all this. And if I can just say, that's one thing. I just use common sense and be calm.
To be perfectly candid, about 11 o'clock, 12 o'clock this morning, I guess, 12 o'clock this morning, I was ready to just get back to the COVID issue. COVID plus the earthquake. No, we don't need that, right? So I really, is kind of a sad state of affairs to say I was relieved to just get back to more COVID-19 related issues. Not that I really enjoy them at all. But that certainly was a scare and could cause some anxiety to rise. But yeah, we as a city, we did, I think what you could describe as a windshield assessment of all the city infrastructure, and it was a great opportunity for our crews to put into action some of the disaster plans and other things that we've developed, and they did a great job. We had reports starting to come in of all of our system within 60 minutes. We were getting full reports of how the systems were operating, and certainly within about 75 minutes, I think all of our reports were in of all of the water system, all of the electric system, of all of our sewer system and things like that. And some might say, wow, that took a long time, but there's quite an expansive system. Our power system, of course, covers much more than just the city limits. Our water system goes up into the canyon, even into the Bird's Eye area, and our sewer system is quite extensive. So I was very pleased with how quickly our crews were able to do those assessments, and hopefully we don't have to do all that stuff again. And I think I would say on the earthquake, people can see the great information coming from the USGS, and finding information from those trusted and verified sources is absolutely the best thing that can happen. We heard a lot of different reporters trying to dispel rumors, and grateful that they were able to do that. But rather than just getting information certainly from Facebook. Here you are watching Facebook Live, and I'm telling you, don't get your information from here. But get information from those good sources, and it's quite instructive to go to that USGS map and see how the aftershocks are happening, and that they're all really focused around the area where the first earthquake that was a 5.7, and Tyler's got it up there on that map. It's really nice to see that the earthquake is doing exactly what it's supposed to do. So initial earthquakes happen, and it releases pressure that's built up in those plates underground. And then all of these little tremors afterwards, aftershocks, are absolutely normal, and they'll go on for days. And most of them, or technically speaking, all of them afterwards are as they occur, generally they're going to be less. And they have been. Some have been pretty good size, but they've been less. And those are great because they're just releasing a little bit more pressure a little bit at a time, and that's what you want to see. So, hats off to Mother Nature. She's acting just like she should, and how those aftershocks happen. So,
Well, again, thank you everyone for tuning in this afternoon for our special Facebook Live Q&A regarding COVID-19 and a little bit with the earthquake that we experienced today. Again, we appreciate the residents who are looking out for one another, that are reaching out to your neighbors, your loved ones who may need special help and care at this time. We appreciate you doing that to help build our community. We appreciate your responsiveness and respect as you go about shopping and going about your life here in Spanish Fork. We've heard good things from the local businesses in terms of your response there. We appreciate residents who are doing things by telephone and via the internet. As we've seen fewer individuals coming into the office, not entirely, we still have some trickling in, but again, we encourage you to take advantage of picking up the phone or reaching out to us online to conduct some of that business that needs to be done, and continue to do that in the coming weeks and days as we respond and navigate this issue together. We will continue to do our best to communicate with you through the various mediums that we've talked about. Our primary goal as a city is to give you the information regarding COVID-19 that's pertinent and related to Spanish Fork City. We may not have all the answers as to the health aspects or other components of this issue that we're facing, but we can get you in the right direction, and we encourage you to look at those resources at the state level and at the county level and with your healthcare providers. But certainly come to us, and we'll come to you with information about recreation programs, about the senior center, about the library, about those essential city services of garbage and water and sewer, and how those may or may not be affected by the virus now and going forward. If you have any questions, again, reach out to us on our website, SpanishFork.org/COVID-19. Send us a Facebook message or give us simply a phone call, and we'll do what we can to answer those questions for you. Again, we appreciate your time this afternoon, and please be safe. Please look out for one another, and we can get through this all together. So again, thank you for your time, and we look forward to seeing you later.
thank you.
Thank you.